This is my thesis research exploring adversity and resilience in autistic individuals. We know that in the general population, childhood adversity is correlated with poor physical and mental health outcomes, but that this effect can be mitigated by resilience, which develops when internal and external protective factors are present in a child's life. What we don't know, however, is how adversity and resilience interact with autism to influence the well-being of individuals on the autism spectrum. A unique aspect of my study was that I did incorporate some participatory methods because historically the autistic community has been excluded from setting the direction of autism-related research and from informing research design. So I recruited 5 members of the autism community to inform the design of my study to make it more accessible and inclusive for autistic participants. I then recruited 4 autistic young adults aged 19 to 27, 3 women and 1 non-binary, and conducted semi-structured interviews via phone, video conference, and online chat. From there, I analyzed the data according to the principles of interpretative phenomenological analysis and then returned to the participants with the themes for some credibility checking, just to ensure that my non-autistic interpretations of their experiences were congruent with their interpretations. So adversity did influence participants' lives, and not only their emotional and mental well-being as predicted, but other aspects of their lives too. So social disconnection from peers and from family, and a negative sense of self. So participants had a really negative sense of self-perception. They didn't understand themselves. They didn't feel like they belonged anywhere, and they had an intense feeling of powerlessness. In terms of their emotional well-being, they expressed suicidal ideation, behavior challenges, and emotional distress, such as anxiety and depression. And these experiences were long-lasting. So the influence of adversity in their childhoods lasted into young adulthood and affected their relationships in young adulthood, their mental health, and the way that they interacted in the world. However, they also experienced resilience, and resilience developed when participants were able to escape the adversity to places of refuge. So these were external places, such as accepting and supportive groups and individuals, and also internal places. So participants were able to retreat into their imaginations and into focusing on their talents and interests. Additionally, their identities played a role in resilience development. So as they developed an understanding of themselves, often which came through diagnosis, they were able to cope better with the adversity that they were facing. Additionally, things like their personal attributes and taking pride in their accomplishments and their talents was also helpful to them. And resilience was evident in the ways in which they were moving forward in their young adult lives. They were all working towards something. They were also striving to improve their mental health and emotional well-being and develop relationships. So there are multiple implications of this research for mental health professionals and for the field of psychology. For participants in this study, adversity not only influenced their mental health, but other aspects of their psychology as well, including identity formation and social and emotional development. Additionally, the condition of autism was not what was adverse to them. It was their experiences of mistreatment by others due to the fact that they were different. So this behooves us to consider autistic individuals in a more holistic way, where autism is a part of their identities. From there, we can consider the context and be curious about what other influences in their lives may be resulting in what appears to be autistic characteristics. Additionally, for the participants in this study, autistic characteristics were also strengths that help to protect them and build resilience, which is important in considering how we approach children and adolescents on the spectrum. And finally, participants made it clear that mental health supports were vital to them. So we need to consider how we can provide effective and accessible mental health supports to this population.